You can see here that we have a scar right next to a tattoo mark. You can see as we pull back around to the left side that we're in the base of the cecum. Here's the appendiceal orifice, and just up and to the left we have the ileocecal valve. So this resection did not involve either. And it is in fact, as we know, that the ileocecal valve is in the medial position. Looking at the lesion overall, we apply a standardized imaging protocol, that published by De Zomer et al. In 2017. We look for any demarcated area with high definition white light. Looking around the whole scar, you can see that you notice a pale area where you cannot follow the large blood vessels into the scar. You see here some lacy blood vessels within, but the large blood vessels on the edge of the scar, and these here, you see that they stop and terminate at the edge of the scar. And that is one of the hallmarks of an endoscopic resection scar. So here we are in narrowband imaging. You see you have that pale center here, the dark blood vessels which can't be followed into the scar, and you have a very much more open pits within the scar than you do with the normal canonic mucosa. In fact, here we're looking for a demarcation zone, which we don't see, and once you have performed that with high definition, then we can apply the near focus mode and really go up close and make sure that anything that we see is not an area of neoplastic tissue. So this is what might be described as a bland post-endoscopic resection scar without any endoscopic evidence of recurrence. Here, in the context of a study, you might decide to perform a biopsy, but certainly there is no need to do so if you're confident with your endoscopic imaging in a standard follow-up of such a patient. Of course, you must respect the standard follow-up intervals as they are published, so 4 to 6 months after the initial EMR, and then 18 months, and then 36 months after that.